In this module, you will learn how addiction affects the brain and how the brain can recover. The medical term for addiction is a substance use disorder or SUD. People can develop an addiction to alcohol, nicotine, opioids, and many other substances. Recent data shows that more than 49 million people aged 12 or older, 1 in 6 people in the U.S., meet the diagnostic criteria for a substance use disorder, SUD. In the U.S., nicotine and alcohol use disorders are the most common substance use disorders, followed by cannabis use disorder, opioid use disorder, and methamphetamine use disorder. In the early 1990s, scientists began to understand how repeated substance use affects the brain. Brain scans show that, like other diseases, SUD affects tissue function. An SUD affects two main parts of the brain: the limbic system and the cortex. The limbic system is located deep within the brain and is responsible for our basic survival instincts. When we do things like eat, drink, find shelter, have sex, or care for our young, the limbic system in our brain reinforces those behaviors by releasing dopamine, a chemical that makes you feel good. That reward for surviving is also transmitted to the amygdala and hippocampus, which record a memory of that feeling so we seek it again. Addiction also affects the prefrontal cortex, which is where decision-making and impulse control live, and what separates us from other animals. When we use drugs or alcohol, they activate the very same dopamine process in our survival center. With repeated use, the substance can compromise or damage that part of the brain. The SUD changes the brain and weakens this system to make it believe that the primary need for survival is the drug. The reward system is damaged, and the brain recodes those primary survival instincts. Suddenly, getting that substance rises higher on the scale of the things necessary for survival, higher than food, water, shelter, sex, and protecting our young. As time goes on, the brain will also need more and more of the substance to activate that same level of reward or feeling of pleasure. As a result, the brain tissue will become increasingly damaged with continued drug use. Research has found that the length of time abstaining from alcohol is associated with improved brain function, increased brain size, and improved memory. Brain scans show that the damage to the brain that happens during addiction can, in many cases, be reversed or partially reversed. There are many factors to consider, including the types of substances, the length of time, and other health conditions. This is also an emerging area in science, so we're learning more each year.